Okay. Good evening, viewers. My name is Dr. Jessica Muthe of Elim Guidance and Psychological Services Center. Today I'll be talking about risk factors for depression. We have been living in difficult times globally. Many people have incurred a lot of losses. Some have lost businesses, others have lost income, relatives and friends, money through con artists, jobs, and so on and so forth. And due to these losses and many more others, people have slipped into stress and finally depression. Today I would like to talk about some of the risk factors that can lead to depression in people's lives. I would want to discuss briefly a few of these risks. One of them is genetics. Genetics means the history of depression in a particular family. Researchers think, or scientists think that this condition can be passed on from parents to children. Some families are more prone to depression than others. In other words, depression can run across families. Number two of the risk factors is death or loss due to death. And as a result of that, sadness and grief can come, and these are normal reactions that occur when people incur or when people go through loss. Loss and grief can be such big stressors as to bring serious symptoms of depression. For example, people can have thoughts of suicide or feeling of worthlessness when they go through a loss. The third one, or the third risk factor, is conflicts, disputes with the family members and friends can cause depression. Personal turmoil, where one is not comfortable with themselves, it can also lead to depression. The fourth risk factor is abuse, and this can mean past physical abuse. It can be a psychological abuse, can be sexual abuse or emotional abuse. All these can bring depression in life of a person. The fifth one are life events, and sometimes even good things like moving to a new place or graduating from a college can cause depression. One can become depressed. There could be many other more changes that can bring depression. For example, getting a new job. In a new job, you have to adjust a lot in a new place, in a new job, and that can lead to some level of depression. What about loss of employment and loss of income, job opportunities, like it has been during COVID-19 period? A lot of losses have incurred, and that means people have suffered a lot of depression during COVID-19 time. Marriage can also be another live event that can cause depression. In marriage, there is a lot of adjustments. It is like two histories are coming together to be one. And due to this, a lot of adjustments, depression can sometimes set in a marriage. What about divorce and separation in marriage? This has a lot of things, changes that one incurs or that one goes through when they have divorced or when they have separated in a marriage. and they require actually not a bit, but much of the therapy, so that they can be able to adjust to that kind of a situation. What about retirement? It's also a live event that comes with those who have been in regular jobs, especially formal jobs, and they have now reached the retirement age. There is a need for them to go through counseling so that they can be able to adjust to now a time of not going to work every now and then. And this is very important. The other one is having a baby. Having a new baby as a young mother can also cause some level of depression. So it is important for one to be supported before and after the baby has come, so that they may be able to overcome that kind of depression. Number 6 is illness. Depression can come as a result of illness. For example, situations where one has sleep problems, that would bring depression. When one is not getting adequate sleep, or probably having too much of it. You have chronic pain, maybe as a result of injuries. It can also bring depression. Anxiety may be due to some situations. That would also bring depression. ADHD is also known to bring depression. There are people who have these conditions or this condition where they are not able to maybe concentrate, or probably they are impulsive, or maybe they are not able to pay attention to many details in life. They are inattentive. That can also cause depression, especially in cases of young adults or even students who have this kind of a condition. What about number 6, which is medication? Depression can be a side effect of something you take for another condition. That means maybe you are on too much medication for maybe some condition. That can be a side effect that can bring depression. In case this happens, it is important for one to actually talk to their physician for further advice if they realize that the medication they have been prescribed to, they have been given, is causing them some depression. What about substance abuse? Number 7, it has been documented time and again that about 30% of people who abuse drugs or alcohol have depression. Heavy users of drugs of whatever kind, whether hard drugs or other drugs, alcohol, have been can bring depression symptoms to those that are abusing them. Social isolation, this can come as a result of other factors like illness, separation from family, and social groups that one has been used to. It can cause depression. So it is important that the people get support when they have left the social groups that they have been used to in the past. Maybe up to their viewers, I would like to talk about how to detect depression in the life of a relative or even in your own life. I start by saying depression symptom can vary greatly from person to person. Episodes of depression may be mild, moderate, or severe. They can also come and go. They can also last for months or years at a time, depending on the person. For some people, depression, and for most people, depression happens gradually. Signs begin to show slowly, and they worsen over time. There are some common emotional behavior symptoms that one can look out for to actually be able to know whether they have depression. One of them is feeling sad, feeling empty, feeling hopeless, and sometimes feeling guilty. That can be a sure sign a behavioral sign that depression could either have set in or it is already there. The other thing is losing interest in things previously enjoyed, like activities. One may have enjoyed football a lot or soccer a lot, and now they are no longer interested in actually such activities. At times one may have been interested in church activities and all of a sudden they lose interest in them. Feeling agitated or irritable is also another sign or another pointer to the fact that one could be depressed. Feeling very tired or sleeping too much or too little can also be another pointer. So it's important to find out, or rather to just evaluate oneself and get to know whether there is a problem or not. The other one is inability to concentrate, especially for those who are in classes or those who are students. They can find it very difficult to concentrate, to think appropriately, to speak. Sometimes it interferes with your speaking ability, and also to make decisions in life. It can make you actually be indecisive. The third thing is that it becomes difficult, or rather, one starts thinking frequently about death, and either through suicide or through other means, and mostly through suicide. Physical symptoms that one is likely to have in their, in their bodies. One is change of appetite. One can have changed appetite. They may either feed too much or too little. We can also experience weight loss or weight gain, depending on the state of appetite which they have. Something else is back pain. Back pain could be caused by many other things, but remember I'm talking about depression and pointers to depression. Headache now and then, or body aches can also be a sign of depression. And viewers, in case one is experiencing such signs, it is always important to visit one's therapist or counselor for psychotherapy. The good thing about therapists or counselors is that they will offer, they will help one to adjust their beliefs, behaviors, or relationships. One can also visit their physician, and more specifically psychiatrists, for medication. And when those multiple interventions are given, it is possible that the situation can be addressed. Thank you very much, viewers. I wish you well.